Fox 56 News Chief Medical Contributor Dr. Ryan Stanton is with us in studio.
This morning, he's focusing on something extremely important, cancer screening.
Well, this is really more on the line of something that could be causing cancer that involves something that we use for screening. One of the most common technologies that we use in the emergency department, called the CT or CAT scanner, may be leading to cancer risk.
Oh boy.
Yeah.
Tell us about it.
Let's talk about it. Yeah, so one of the most common things, the evolution of technology we use in medicine has advanced significantly. And one of the most important tools that we use to diagnose things that are going on inside of our body is called a CT or CAT scan. Well, the CAT scan uses ionizing radiation to develop and get those images. Well, the problem is this causes cell instability and potential for the change in mutations that lead to cancer. In fact, a new study came out that states that about 5% of cancers that are newly diagnosed in the United States may be partially caused by CT scans. We're doing about 100 million of these scans every single year here in the United States, and the challenge with that is these are an integral part of diagnosing issues going on inside the body and are life-saving, but at the same time we have to be very selective in terms of when we're using them, and most importantly when we don't need them. So a lot of times the key here is this is an age-related challenge that's higher risk for children that are exposed to the ionizing radiation of CT scans. The risk drops significantly once somebody's over about age 50 just because of the time and the lack of replicating cells that we have. So we want to try, especially with children, look at abdominal pain, look at the head CTs from minor head injuries to limit some of those scans as much as possible, and the technology to decrease the amount of radiation necessary to get the best images while having the least exposure to that radiation.
Sounds like this is a last resort type of thing for younger people.
Well, it depends. Like with belly pain, looking for appendicitis, we're going to lean more towards the ultrasound. When it's somebody with a head scan who comes in saying, I think I have a concussion, we don't necessarily want to do a CT scan because we have tools we can use to predict that you don't have anything significant going on. And in fact, we don't diagnose concussions with CT scan. It is a clinical diagnosis, not an imaging diagnosis.
All right, well, Doc, thanks so much. We'll see you again in about 20 minutes or so.
Yeah, about 30 minutes or so,
Yeah.
and we're going to talk about a new blood program that's coming out here in Central Kentucky.
All right, sounds good. We'll be right back.
You're watching Fox 56 News. Our home, your news.